Hey, Dr. Kenneth DeLay here, board certified urologist practicing in South Carolina. So what does lithotripsy mean? So patients don't realize this is kind of an overarching term that doesn't tell you exactly how the urologist is going to break up your stone. Lithotripsy literally means to break up a stone, and there are multiple ways of going about that. For most stones, we're going to do something called laser lithotripsy, meaning using a laser fiber to break up the stone. So this is done through a process called ureteroscopy, where you're asleep in the operating room the majority of the time. We run a small scope called a ureteroscope into the ureter and then place a laser through it and use the laser to crack and fragment the stone. We can either then remove the pieces or basically bust the pieces up into such small fragments that they will pass easily. The other way that we can break up stones, and have done this historically, is with shockwave lithotripsy. So a lot of people think this is what they're getting when they hear the term lithotripsy, but once again, lithotripsy just means to break up a stone. So shockwave lithotripsy is a process where sound waves are used, and they are targeted towards the stone from outside of the body. And there are a variety of different types of devices that have been used to do this. Now, we mainly use what's called a piezoelectric lithotripter now, but the basic idea is the sound waves break up the stone into fragments that are small enough to be passed. Here, once again, the patient is usually asleep, but we don't have to place a scope inside for the most patients because the stone is broken up. The final way would be called a lithotripsy using a pneumatic or ultrasound-based lithotripter. And this is done when we do something called a percutaneous nephrolithotomy, where we go through the back, and this is done to break up much larger stones. So the most common way in the current era would be to do ureteroscopy and then laser lithotripsy. Some urologists still use a lot of shockwave lithotripsy. This is kind of geography dependent and somewhat practitioner dependent. And finally, if you have a really big stone or complex anatomy, you may need what's called a percutaneous nephrolithotomy. And then once again, you can use a pneumatic or ultrasound-based lithotripter to break up the stone in those cases. I hope this was helpful. If you have any questions or comments, place them in the comment section below, and I'll be sure to get back to you.